Everyone knows about the flu. Mostly it occurs in the North America in the winter season, although it continues throughout the year. Whenever a new virus is introduced into the human population, then that because the people do not have any immunity, many people get affected and it spreads globally in an epidemic fashion. That is what has happened now with this initially called swine flu, then named as H1N1, that is called H1N1 pandemic flu, that is affecting the whole world at this point in time. The Public Health Department, the Ministry of Health and Ministry of Education had a meeting to develop our prevention and control strategies when the schools open. One of the things that we are doing is a letter is going to be sent out to all the parents as soon as the school is open with their children, along with what they should do in order to protect their children from getting flu, as well as if they get it, how to prevent further spread of that.
Our goal is always to keep schools open and functioning in a normal manner as far as possible. And really school closures will only ever be a last resort. But as a parent of school-age children myself, I certainly can understand the need for parents to know that their children are safe. And I can assure everyone out there, the listening public, that the health and safety of our children will always be a priority. Any decision that we take here in the ministry will always be with the guidance of our local experts, but as well as with, we will always follow international guidelines such as those produced by the WHO.
We have the school nurses, we have the public health nurses, so we'll be monitoring if there is any surge in cases so that we can take an appropriate measures.
Prior to school closing, we were in schools with the other school nurses creating awareness among parents and teachers and children with the influenza. And that's from June to July. So now we will continue come September, especially among PTA and Homeschool Association. We will be going in to do more awareness as it relates to the H1N1. However, we have two clinics, Georgix and John Gray, and we have nurses who are assigned to those clinics full-time. But we have nurses who offer school services. They visit to other schools. So just in case a child is sick, the child will be taken care of until parents or caregiver arrive at school. We would like parents to update their contact list, their telephone numbers, just so that if a child gets sick, we can call them or have somebody else, an emergency contact, if we're not able to get in touch with them. We really would like to minimize the spread of this influenza, and so we want parents to practice with children at home to minimize the spread. Do hand washing at home. Use the tissue at home for coughing, sneezing. Dispose of it, wash hands. If this becomes a norm for the children, then they will practice it at school.
We advise mostly if somebody is sick with flu, stay home. And also stay home means stay home. Don't go to supermarket, don't go to play with other friends and other neighboring children, etc. Then, however, if the parents feel that there are some symptoms are getting worse, they should seek the medical attention. There are some children may be there who are immunocompromised, that means their resistance power is low for various reasons. The doctors might have told the parents, or the person may have a lung disease, or a kidney disease, or a heart disease. Those ones should seek the medical attention immediately when they develop these symptoms. Of course, the schools will take measures, sanitary measures, because the children do cough on the tables, desks. They may be bathroom, toilets, doorknobs and other places sanitization is required. So the education department will be taking those measures to take that. And also there are private schools, so I urge every school to do their part of it. We will do our part of it. Parents do their part of it, and at the end of it, we will succeed in managing this outbreak.